Hello everyone, welcome to the first in the infectious diseases series. So today we're going to be learning about Lyme disease. Lyme disease is an infective disease that is a multiform tick-borne disease. It is typically caused by the bite of a specific tick called the Iaxidus scapularis. This can be seen in the picture above of the white insect. This tick carries a bacteria called Borrelia burgdorferi, and this is commonly found in the northern hemisphere. So typically, very commonly found in the USA, as well as other bacteria that this tick can transmit, such as B. alphalzelli and B. guerini, can also be found in Europe and Asia. There's about roughly 2,000 to 3,000 cases a year in the UK. The presentation is taken in three stages. So, the early localization. So, this typically happens within the first month of being bit by the tick. So, there's an incubation period of roughly 30 days. So, the first most prominent presentation will be erythema migraines, which you can see from the picture of the circular rash. This is typically non-pleuritic, so non-itchy, and tends to expand and forms a bullseye kind of appearance, as well as being accompanied by symptoms such as fever, malaise, headache, myalgia, muscle and joint pain, particularly in the big joints such as the knees. This can progress into stage 2 within the next weeks and months if not treated, to develop serious CNS disorders, particularly neuritis, cranial nerve palsies, and meningitis, as well as cardiovascular diseases such as Lyme carditis, because the bacteria can then go on to infect and affect the heart's electrical conduction, and impact on the movement of signals between the SAN and the AVN, leading to first degree, second degree, and third degree heart blocks. If this still persists within the next months and years, this can then progress into very serious Lyme arthritis and acrodermatitis chronica atropicans. To investigate further, we would look for signs, very clear clinical signs, such as the erythema migraines, the bullseye rash, and do serology to test for the Bergdorfeli antibodies. First line treatment of Lyme disease would be to give antibiotics such as doxycycline, typically 100 milligrams once daily for 10 to 21 days. This can be contraindicated in pregnant women, lactating women, and children under the age of 8. And in these incidences, we would give other antibiotics such as amoxicillin, azithromycin, and phenobenzyl penicillin. Second-line treatment, particularly in cases of arthritis and carditis, would be ceftriaxone, 2 milligrams daily via intravenously. And obviously, conservatively, would want to keep the limbs covered and use insect repellents to prevent further tick bites. Thank you for this presentation on Lyme disease. I hope you enjoyed. Please let me know if you have any questions in the comment section below.